Hi everyone, today I, Akshie Sharma, is going to tell you about the component parts of fixed partial denture. Fixed partial denture, or as we call it as a bridge, it consists of a replacement of the missing tooth, taking the support of the two adjacent abutments. Since in this picture these are the two adjacent abutments and this is the missing tooth that is to be replaced. So as they have specified, this is the pontic. These are the retainers that cover the abutment tooth, and the retainer to pontic attachment is connector. So we are going to discuss them in detail. The part of a fixed dental prosthesis that unites the abutment to the remainder of the restoration is the retainer. Now we are going to classify them. They can be classified based on the amount of tooth coverage. It can be complete coverage or full veneer retainers. These are the retainers that cover the abutment teeth from all the parts, from all the surrounding areas, from all the aspects. That is, a tooth is covered fully by the retainer. In cases of partial coverage or partial veneer retainers, it covers the partial tooth. Abutment tooth is covered partially. These are also known as 2/3 crowns or 3/4 crowns or 7/8 crown, 1/2 crown, pinlays or pinledges. Then comes conservative retainers. Conservative retainers, they require minimal tooth preparation and they are usually indicated of interior teeth, so that the labial surface is the natural tooth whereas the preparation is done on the rest of the surfaces. Now, based on mechanism of retention, there can be extracoronal retainers which provide retention from the external surface of the abutment teeth. Then comes the intracoronal retainers which take retention or obtain retention from the coronal surface within the coronal surface of the teeth, like inlays or onlays. Then comes the radicular retainers which obtain retention within the root of the abutment teeth. Now we are going to classify it more on the basis of material used. They can be all metal retainers, they can be partial or full coverage retainers. They possess good strength and they require minimal tooth preparation, as 1 mm of the metal crown is required for preparation. Then comes metal ceramic retainers. They are the most commonly used. They are indicated both in anterior and posterior teeth as they are economically stable. Then ceramic can be either a facing on the labial side or it can be a full coverage. Then they require more tooth preparation than all metal type, as it includes both metal as well as ceramic. Then comes all ceramic retainers. They are the most aesthetic as no metal is present and they need maximal tooth preparation for the strength. Then come the acrylic retainers. They are mostly used for temporary fixed partial dentures. Now, what is the criteria for selection of retainers? If the abutments are parallelly placed, then there can be full coverage retainers can be used. If they are non-parallel, then one of the abutment can be full coverage and the opposing one or the other one can be partial coverage, or either both of them can be partial coverage. That is usually decided by taking into consideration the position or the condition of the abutment teeth. Then the condition of the abutment, if the abutments are in good health, in cases of periodontium or caries, then a partial veneer retainer can be considered. If the abutment is endodontically treated, that is root canal treated, then a full veneer retainer is recommended because the strength is more required. And if the abutments are periodontally weak with exposure of the root surface, then conservative resin bonded retainers are indicated. In cases of aesthetics, as we said before, all ceramic retainers are best indicated for aesthetics, so they are used anteriorly, and metal ceramic resins or metal with the ceramic facings, they can be used posteriorly. In cases of preservation of tooth structure, the partial veneer preparations are more conservative than full veneer preparations, as the labial surface is devoid of preparation. Then comes retention. as a molar exerts more force than compared to a premolar, so it requires more retention. So longer is the span, greater is the retention period required. And in cases of cost, full veneer, all ceramic retainers are recommended in case of interior tooth replacements, but as they are expensive than metal ceramic and facing retainers, if cost is a factor, then metal ceramic retainers can be considered for interior region and all metal for posterior region. Now we come to pontic. The pontic is actually an artificial tooth on a fixed partial denture that replaces the missing tooth, restores its function, and usually fills the space previously filled by the natural crown. In short, the missing teeth that has to be replaced is the pontic. The pontic covers the area of the missing teeth. Now we are going to classify it. Based on mucosal contact, it can be with mucosal contact or without mucosal contact. Number 1 is ridge lap or saddle pontic. It covers both the labial as well as the lingual surfaces, and it is covering therefore it is known as ridge lap, as it covers both the labial or the buccal and the lingual surface. Then modified ridge lap, it just covers the labial surface of the tooth, it doesn't cover the lingual surface of the tooth. Ovate pontic is an O-shaped pontic that is oval in nature. It also just covers the labial surface. And conical pontic is an egg-shaped pontic that is conical in nature and it also covers the labial surface. Then without mucosal contact, it can be sanitary or hygienic pontic, that is the pontic doesn't covers the gingival surface, it is away from the gingival surface, and the cleansing property of the FPD is maintained. Then comes modified sanitary or pedal pontic or arc-shaped FPD. It includes of a mesiodistal concavity that is present in a pontic, and this is known as modified sanitary. Then based on the material used, it can be all metal pontic, that the missing tooth that is replaced is composed of all metal. Then it can be all ceramic pontic. Then it can be metal with resin facing pontic or fiber reinforced composite pontic. So these are the different types of the pontics based on the requirement. Now ideal requirement of pontics are: it restores function of the replaced tooth, it provides aesthetic and comfort, it should be biologically acceptable, it permits the pontic should be biologically acceptable, it permits effective oral hygiene, it preserves the underlying residual ridge and mucosa, and it have adequate strength to withstand occlusal forces. Then based on method of fabrication, they can be custom made, that are made by taking the impression of the arch, and then there are prefabricated pontics that are prepared in different sizes and are available in the market. Then comes the connectors. A connector is that portion of the fixed partial denture that unites the retainer and the pontic. Now the types of connector, there are two types of connector. Number 1 is rigid connector and number 2 is non-rigid connector. Rigid connector does not allow any movement between the retainer as well as the pontic, whereas the non-rigid connector, they are flexible in nature and they allow a bit of movement between the retainer and the pontic. In rigid connectors, all of the force is provided or is given to the abutment teeth, whereas in non-rigid connectors, the force is equally distributed. Now, rigid connectors can be cast connectors, they can be soldered connectors or loop connectors. That is, the retainer and the pontic can be connected by casting it, or it can be soldered, or it can be connected with the help of a loop, a rigid loop. In cases of non-rigid connectors, they can be tenon mortise connector, they can be split pontic connector, and they can be cross pin and wing connector. In cases of tenon mortise connector, the tenon is the male part, which is actually produced, and the mortise is the female part. The tenon is attached to the pontic and mortise is attached to the retainer. First, the mesial part is incorporated into the oral cavity and the distal part is then connected to the FPD. Now comes the split pontic connector. Split pontic connector is used in case of pier abutment situation where a minimal amount of movement is required to maintain abutment health. The pontic is again split into mesial and distal half, which are attached to their respective retainers. A shoe or key is incorporated into the mesial half and the keyway is attached to the distal half. This engages when the FPD is seated into the position. About crosspin and wing connector. The crosspin and wing connector are similar to the split pontic connector and are used for tilted abutments. The wing is attached to the distal retainer, which is cemented first, and the pontic to the mesial retainer. Here, the crosspin and the wing connector is the only connector in which the distal part is seated first and the mesial is seated afterward. Thank you.